Hello, everybody. Welcome to episode 10 of the Apollo Cannabis Now series. My name is Arash Taghvai, and I'm one of the patient care specialists and medical graduates that works at the Apollo clinics. Today's topic is headaches. We're going to discuss a few different types of headaches, how medical cannabis can play a role. I've prepared a couple of case studies at the end, and of course, as always, we'll be taking the questions that were sent in. Thank you for all those who did send questions in. Let's get right into it. Headaches and migraines are going to be today's topic. We're going to cover three different types: the cluster headache, the tension headache, and then the infamous migraines. First, let's start with cluster headaches. These headaches are actually considered to be short in duration. Although I don't think 3 hours is short in duration, they are classified that way because they can be much, much shorter, as low as 15 minutes. One distinguishing factor about cluster headaches is that they are unilateral, only on one side of the head. They also come with what's called periorbital pain, which is pain behind the eye. There also can be something called rhinorrhea involved, which is a runny nose on the same side, ipsilateral to the eye pain. And sometimes patients even report lacrimation, which is just a fancy way of saying tears that run from the eye that is in pain. Cluster headaches can present in a similar time daily. So a patient may say, I have them every evening at 7 or 8 o'clock, and then they last until I go to bed, and I don't know what it is. They are a higher incidence in males. There's also an increased incidence in people who have a history or current smokers of cigarettes. The treatment for cluster headaches is a class of medications that I will be referring to several times during this presentation, known as the triptan class of medications, more specifically sumatriptan, and also 100% oxygen. If a physician feels that the patient would benefit from that, that would be another treatment option for them. The next type of headache is a tension headache. Tension headaches are bilateral, and they sometimes have a band-like appearance. It doesn't necessarily have to go through the front of the head, but that's the best part that I can reach and show you guys. Tension headaches are treated with pain management with the use of NSAIDs. The final one on this list are migraines. Now, if we look at the main difference between these types of headaches, there's pain involved with all of them, but very few headaches will go as long as a migraine. 72 hours, they can be as long as. Again, a 24-hour headache sounds bad enough. I can't even imagine going past 2 days and then into 3. So migraines are quite distinct. They have two phases to them, and they come from a bit of a phenomenon that we don't really understand. There is vasodilation and vasoconstriction involved in all types of headaches, but with migraines, it's more rapid and there's both. The initial phase of any migraine will be the dilation phase. Patients report that they have trouble with bright lights and they have trouble with loud sounds. Well, this is all due to the increased blood flow to those organ systems. So if you have a lot of blood going to the eye, you're gonna have some photophobia. Light's gonna hurt. If you have a lot of blood flow going to the ears, well, everything is amplified, and the smallest noise or the loudest noise can cause phonophobia, acoustic pain. If blood flow is increased to the oral pharynx, there have been reports of dysgeusia, which is just a fancy way of saying you have a different taste in your mouth. Patients sometimes report it's a metallic flavor that they have, and then their headache sets in. After the initial vasodilation in a migraine comes the vasoconstriction. And the vasoconstriction is when most of the pain is present. And once that vasoconstriction kind of gets a hold of the patient, it's time, dark room, quiet room, and rest. Most pain medications do not affect this headache. So again, they can be very debilitating. When it comes to patients of Apollo, we kind of see two categories. The first category, which is probably the lower number of patients, come to us just to talk about their headache. A patient may say to us, well, I've discussed my migraines with my family doctor. He has referred me to a neurologist. They gave me their opinion. They gave me their treatment options. None of it has worked thus far. So I am here today to see if there's anything else that can be done to help with my migraines. The second type of patient that we see, and this is probably way higher in number, are the patients that come for one primary reason and then find the benefit of headache relief. So I'm here to help my condition known as insomnia. Or I've been struggling with fibromyalgia for many years, and I'd like to use cannabis-based medication. Or I've been in a battle with osteoarthritis for many years, and I wanted to try cannabis-based medications. And they all come back and towards the report, well, my pain scale has come far, far down from what it used to be, and for any given reason, my headaches are gone as well. What's going on here? Can you explain that? And it's quite easy for us to turn to the patient and explain to them that the endocannabinoid system has receptors in the brain and the vascular system. So if we look at the brain, there's both CB1 and CB2 receptors, that's both THC and CBD. A patient who uses CBD on a consistent basis has the potential to slow down the incidence, the occurrence of headaches. And also, a patient who uses either CBD or a dose of THC can help with the pain once a headache is present. Again, important to note that cannabinoid receptors are in both the central nervous system and the vascular system. Multiple studies have been conducted for the use of cannabis-based medications and headaches. Some of the initial numbers are staggering. 80% of people who use medical cannabis to treat a headache stated that it helped with the severity of their symptoms. 50% went on to say that they had a decrease in incidence. This is very, very good news. These are very, very big numbers in the world of medicine. If a patient ever suffers from more than 4 headaches a week, which equates to 16 headaches over a month, they are considered a chronic patient. So if we can use CBD or use any cannabis-based medication to bring down the incidence of headaches, we can take them out of the category of chronic and put them back into headaches. And it's a step back, and it's a positive thing for them. So very, very important to know. Another very important thing that was mentioned on these studies is that cannabis does not lead to medication-based headaches. This is an interesting thing to go over. Sometimes patients who use medication for headaches will say that after a while of using this, after a couple of months of using a sumatriptan, it causes more headaches than it helps with. So this is documented, this is known, and again, cannabis does not cause that in patients. So the main chemical component that we use, the main molecule that comes off of the plant for cannabis-based medications is CBD. This is not the first time I've reviewed it, so I will go quickly. We understand that it is a non-psychoactive component, so it can be used regularly throughout the day. And regular use has shown a reduced incidence of headaches. It has anti-inflammatory properties. It can help with some of the nausea that presents with migraines. Obviously, also, it's known to reduce anxiety and pain. But the biggest point is the last one here, less incidence, guys. Remember, you can take a patient out of the category of chronic headaches with the use of cannabis-based medications. The second compound that we use is THC. Now, THC is the psychoactive component of cannabis, but it's very important to note that it is dose dependent. Okay? We understand what we don't want to feel and we stay beneath it. THC can add further pain control. It is also an excellent sleep assistant. Sometimes patients will tell us, when I get a migraine, there's really nothing I can do. I turn off the lights, I put a pillow over my head, and I just rest. And I need a day off, and I need a good 12 hours of sleep. Although I won't attain it, I can't leave my bed. I'm in so much pain. So again, THC is helping these people kind of fall asleep, call it a day, and then when they wake up, they're feeling much better. It also, as mentioned previously, helps with chronic headaches, people who have very high incidence. Forms of medical cannabis that can help these patients. I've put here the latest updates that have come out from all the licensed producers that are authorized by Health Canada. There's ingestibles, which are oils and soft gels, and we've now added edibles, right? Some of the licensed producers are making them. They could be chocolates, they could be brownies or whatever else is out there. It is important to note that they all have the same metabolism required by the body, which is first pass metabolism. So whether it's an oil, a capsule, or a chocolate, it's going to go down into your stomach. The liver is the organ that's responsible to redistribute all fats. That process takes about 1.5 hours to 2 hours to kick in. The second form that's available to patients is inhalation. So dried cannabis flower and a Health Canada approved vaporizer. And now we have access to pre-filled vaporizers. Again, Health Canada approved. These are not recreational devices, guys. They're very different. The difference between the ingestibles and inhalation is going to be time. Obviously, with an ingestible, like mentioned, it takes about 1.5 hours to 2 hours to kick in, whereas the inhaled form can be immediate, right? Less than 5 minutes. So a lot of patients will reserve that for breakthrough pain or an unannounced headache, if there is such thing. If things are quick, you can combat that with a vaporizer. We've got to the case studies. First one. This is a 27-year-old female with a past medical history of fibromyalgia and migraines. Presents to consult for pain management. She wasn't here for the migraines. She states that she is unable to function when her pain levels are high or if her migraines do occur. Her past treatments were sumatriptan and propranolol. Guys, just to quickly explain, propranolol is a beta blocker and it helps with heart rate control. When the phenomenon of any headache occurs, there's vasodilation and constriction, and that can increase the heart rate. What they're hoping they will benefit from with the use of propranolol is if they take away that increased rate, it may decrease the symptoms of a headache. And there has been noted success with that. This particular patient did not like using her pharmaceuticals. She said the sumatriptan didn't really help, and she didn't like the effects that she felt with propranolol. The Apollo treatment plan was CBD during the day, a dose that was consulted with her physician during her appointment, and THC was reserved for when migraines did present or if things got severe. After 6 months, the patient reported a decrease in the incidence and severity of her migraines and fibromyalgia, and she was able to come off of all her pharmaceutical prescriptions. She was very proud of this. She was very happy about it. We considered this a huge success for her, and she instinctually loved the treatment plan that she received, and she was very happy. This patient became a bit of an advocate. She started telling other people about the success that she had, and you can understand why. The second case, this is a 42-year-old male that presents with unilateral pain most evenings behind the eye. Pain can travel on the same side of the eye pain, remaining ipsilateral, same side. He reports that at times he has a runny nose that coincides with the head and eye pain. Pain presents most evenings, so it is episodic. Past medications include over-the-counter medications, prescription pain medications, deemed unsuccessful due to the side effects that he felt. Apollo's treatment plan for this particular patient was CBD during the day, and also the physician added a dose 2 hours prior to the time in which the headaches normally began. And if we stop to think for a moment, if we're adding a dose and it takes about an hour and a half to 2 hours to kick in, and we know the headaches present every night at 8 p.m., well, let's take a dose at 6 p.m., and the medication will be at a high value in your body when that problem presents. Patient reports headaches are no longer present. So he was actually able to fully get rid of his headaches, and he uses the medication when he needs it. He actually stated to us that he put it away for a couple of months, and he found that the headaches came back eventually, so he uses it now when needed. And that is another excellent feature of medical cannabis or any cannabis-based medication. You don't necessarily need to wean off of it. We can wean up slowly to find your therapeutic index, but once that is found, you now have that knowledge and you can use that dose anytime you need it, like any other medication is. All right, so we are at the questions and answers portion. I put a few notes on this slide that I thought would be helpful for people who are tuned in. Apollo does have personalized educations and treatment plans for all our patients. Like any other medication, there is no one size fits all. It is a personalized treatment. We now also help our patients fill their prescription and registrations with licensed producers, same day of appointment. We offer 7-day-a-week support. We also have phone and video appointments across the country to be in accordance with the pandemic guidelines given to us by the federal government. So let's get to the questions. First question, guys. Okay, question states, does cannabis interact with the family of triptan medications? That's a great question, and the answer to that is no, it does not. They use different pathways of metabolism. They don't affect each other. If two drugs use the same pathway, it could cause some traffic, and that's how medications can interact, but in this particular case, they do not. Good question. Second one, I already take CBD oil for another condition, which is my arthritis. Will the same strain or product I already have help with my migraines as well, or should I ask for an alternative in another appointment? Well, the answer to that question is it'll depend on if your migraines have been helped with the strain that you have now. If you find that you are using a strain of cannabis that's really, really helping with your pain, but the migraines are still present, well, then we have to have a discussion as to a potential addition of a different strain or a different capsule or different oil that can benefit your migraines. So the answer to the question is yes, another consultation would be warranted in this case, And we can discuss adding either a microdose of THC or a different strain of CBD to see if there's any more benefit other than pain relief. So excellent question. The next question is, what strains are best for headaches? Guys, whenever I hear somebody ask me about strains, I like to step back and understand that there are sativas and there are indicas when it comes to cannabis. There are many, many recreational names that aren't really important to the medical practice. We know them, we understand them, but we don't really prescribe per strain. We will say that we could potentially try a sativa and see if that'll help. And if there is no help, we will move on to an indica, just the same way you would for different classes of medications when a physician does that as well. But generally speaking, what we've reported in clinic is that the indica strain helps a lot more with migraines compared to the sativa strain. But again, that is all just documented based on patient feedback to us. And of course, we listen, we document, and we share that information when necessary. So last question here. If I feel a migraine coming on, what form of cannabis can I take to combat it with a timely manner? So I wanted to address this question because it can be answered in two different ways. First, modern medicine, and then medical cannabis. So the triptan class of medications can help with migraines and other headaches, but most physicians will tell their patients, the minute you feel your headache coming on, take this medication. Fingers crossed, the doctor's thinking, fingers crossed that it will be absorbed, metabolized, and get to those receptors in time to stop that headache, which is generally why the triptan class of medications isn't very successful. Most people aren't fast enough with the medication. The advantage we have for medical cannabis is that the medication can be inhaled. And again, to fight the popular misconception that if you are using inhaled cannabis, you are attaining euphoria, that is not the case. Patients are now able to inhale a CBD strain for more immediate relief. So our answer would be inhalation would help that patient. Another very good question. So that brings us to the end of episode 10. I want to thank you all for tuning in and the continued support for these videos. I hope you enjoyed it. If you guys have any questions or have anything else that you would want us to discuss in future videos, please send them to us. Booking at Apollo Research for appointments, marketing at apolloresearch.ca for any future ideas. Thanks so much. I hope you guys have a great day.